Yes, so I think that, again, has been the narrative of COVID-19 in the United States. It's science versus politics rather than science plus politics working together, like it has in so many other countries around the world, like Germany, New Zealand, Taiwan, etc. So I think that the trust in the CDC has really been reduced given the flip-flopping of recommendations, the introduction, and evidence that politicians have infiltrated the highest ranks of the CDC in terms of publications, et cetera. But they they were the bastion of public health in the world, and I think they really need to pick themselves up and move forward so that we can trust them again.
That being said, conflicting information about testing guidelines that we've seen in recent days, even masks. And that's not the only information, as you've mentioned, that they've released under scrutiny. So where should citizens get reliable information, if not from the CDC? Who do they listen to?
Right. So I think it varies by states. But I think that, the National Institutes of Health, I think Dr. Fauci is always dead on correct in this information. And, I think we, listen to your local public health leaders, look at guidelines, look at the peer-reviewed publications. I know it sounds like disparate bits of information, but that's really what the reality of COVID is in the United States currently.
It's where you live and what's happening in your region. I want to ask you about a vaccine as well. That's also been the big talk, the availability of a vaccine when it is available, the authorization by the FDA. The president says one thing, and then, as we heard, the administration saying the opposite. So what are your thoughts on what you're seeing right now in regards to a vaccine in the United States and around the world?
Well, I think there are several phase 3 studies going on right now. I think the announcement that Johnson & Johnson is unveiling their phase 3 trials, or have started this week, is good news. I think that people are still being burned by the public mistrust. So the approval for the vaccine, those people who say they would get the vaccine tomorrow, dropped from 70% to 50%. So I think that's troubling. But nevertheless, the science is marching forward. The FDA has released statements saying that they're really going to have strict guidelines before releasing a vaccine or approving a vaccine. So I think that's kind of percolating into the communities now, and people are really, unsure still, I would say, on the ground level.
And look, we're seeing spikes, new spikes across Europe. We're seeing the United Kingdom imposing new restrictions for the next 6 months. As we approach fall and winter here in this hemisphere, based on what you know about COVID-19 so far, what are the numbers telling you, and what should we expect?
It's inevitable that we are going to get a spike again. And of course, everyone is talking about the twindemic of influenza and COVID. It's going to strain testing because these symptoms of influenza, COVID, other respiratory viruses are very, very similar. You can only distinguish them from testing. So that means that people who have the cold or influenza, which is much more common in the winter, will go and want to get a COVID test. So all of a sudden, we really need to have, production in anticipation of this surge, not only in cases, but in testing, PPE, hospital beds, etc.